Hello everyone, my name is Cheryl, Nicole, Hendricks. Along with my other group mates Omar, Ervyn, Beevenna, and Resihka, we will be presenting on the Clinical Information System, or also known as the CIS. So let me begin by introducing what Clinical Information System is all about. So what is Clinical Information System? Basically, it is a computer-based system that is meant to gather, store, and alter clinical data on patients. So these systems may be used at single locations or across entire healthcare systems. The purpose of CIS is to integrate, collect, store, and manage data from a number of sources to support healthcare operational management, support policy decisions, and manage patient data. Clinical Information System also provide quick access to current patient data, including clinical notes, medication history, laboratory reports, and images. Besides that, Clinical Information System improves the quality of patient care, enhances operational efficiency, and supports evidence-based decision-making for healthcare professionals. This system also reduces test and medication errors through dose adjustment, dose range checking, therapeutic duplication checks, formulary alerts, and drug allergy and drug-to-drug interaction checks.
The benefit of Clinical Information System is to improve communication between the health professionals caring for each patient and to interconnect with other subsystems in the hospital, such as pharmacy, different laboratories, radiology, pathology, and so on. Besides, the Clinical Information System also helps to improve patient care by providing a centralized system for storing and accessing patient medical records. This allows healthcare providers to more easily share information and coordinate care. For example, a clinical information system can import data from different instruments such as vital sign monitors, ventilators, and infusion device, and then store them safely. It displays them in specific tables and formats. Apart from that, clinical information system also benefit in saving time. A clinical information system can assist with automating tasks like scheduling appointments and arranging lab testing. This can free up time for providers to focus on more important tasks. Moreover, a clinical information system also provides all the information and decision support tools to improve patient care. This guide the health professionals to provide the best treatment for the patient based on their medical history and current condition. In addition, a clinical information system can help to track patient outcome and quality of patient metrics. This information can be used to identify areas where care can be improved. The clinical information system contributes positive impact to the patient's safety and workflow efficiency.
Here are some common applications of CIS alongside with their examples. The first one would be electronic health records, which is known as EHRS. So EHRS are digital versions of patients' medical history. They allow healthcare providers to access and update patient information in real time, facilitate seamless communication, and coordinate between different healthcare professionals involved in that particular patient care. The example for this would be Epic System EHR software, which is widely used in many healthcare institutions. They provide comprehensive patient data and also streamlined workflows. The second one would be computerized physician order entry, which is known as CPOE. CPOE allows healthcare providers to enter medical records such as prescription, lab tests, and as well as referrals electronically. This can actually reduce errors, especially errors that are related to illegible handwriting that cannot be understood, and ensures that the orders are consistent with evidence-based protocols. The example would be Cerner's CPOE system, which assists healthcare providers in ordering medication, lab tests, and other services directly through their software. The third one would be mobile health, mHealth applications. Many CIS now have mobile applications that allow healthcare providers to access patient data, receive alerts, and communicate with the patients and other healthcare professionals on the go. The example for this would be Cerner's Heal the Life app which allows patients to access their medical record, schedule appointments, and communicate with their healthcare providers using their mobile devices. Lastly, we have Clinical Decision Support System, which is known as CDSS. So CDSS provides healthcare providers with evidence-based guidelines and alerts to support clinical decision making at the point of care. It helps in identifying drug interactions, recommending appropriate treatment, and detecting potential medical errors. And for this, the example would be IBM Watson Health CDSS, which analyzes patient data to offer personalized treatment recommendation based on their medical literature and best practices.
Hello and greetings to everyone watching. My name is Omar Mohamed Sulaiman and I will be presenting about the current issues that persist with using the Clinical Information System or CIS. Here I have 5 points that I wish to bring about, with the first being the lack of interoperability. Basically what this means is that the existence of many types of usable software does not mean that CIS should support all of them. It is very likely that one CIS component may be incompatible. As a result, the seamless transfer of information between healthcare systems is quite affected and can hinder data flow as well as providing a high quality service of care. The next point is inaccessibility. It describes how CIS is responsible for storing a large amount of different types of data simultaneously, even being able to input them at a very high pace. However, when viewing the interface, it is easy to get overwhelmed and the variety of data can become a hassle, as they are typically not integrated with each other properly. As known in the medical field, this is actually very important because one criteria will always have some type of relation with other factors. So this is another problem with CIS. The third point is protection to the files of data. In health information systems being digitalized in this era, the biggest concern is always towards security, as there are many personal and sensitive information about the patients. This leaves the CIS to be susceptible to attempts at hacking to acquire the information. This can be avoided with regular software updates as well as scans by means of an antivirus software. Another potential issue is the storage of the vast amount of data. Because CIS is a real-time system in which is constantly being input by multiple different data sources of patients in terms of like vital signs, it becomes a hardware or storage related issue towards the end. So it should be able to hold the data for long-term retrieval as well as for research purposes. Finally comes the ethical concerns, like in any topic that leads to progress of research. This is always present and depends on one's medical rationality, which obviously differs from a professional to professional, and the patient's consent themselves. However, if purely the values and numericals are used without any linkage to the patient, it is relatively safe for use in a research manner. So that will be all the issues, and the following part will be closely linked, so stay tuned.
Good day, sir. My name is Ervyn. Today I'll be talking about the barriers of the Clinical Information System or CIS. So, in this clinical information system, basically there's four main barriers that we need to talk about. The first one is the initial cost. Organizations and investors usually try not to invest in this clinical information system as it has a very high cost of just running the basic infrastructure. Furthermore, they are not willing to invest huge sums into running this basic infrastructure as it raises many questions on the advantages and consequences running this clinical information system has to the organization or the hospital itself. Furthermore, talking about privacy and security, this is a very important issue as the medical privacy and security of the patients needs to be well guarded, and the clinical information system can also have many issues as it's not very reliable because it may have some loopholes that allow hackers and third party individuals from taking and exploiting the privacy and the medical data of the patients itself. Thirdly is the clinical resistance. Basically, this is talking about how useful it may be to the doctors or the nurses that's involved because for them timing is everything. Having time with the patient to assess the patient and giving the patient the time to actually explain their illnesses and what they are going through is very important. The usage of CIS prolong this time, may prolong the time that the doctors need to actually check up on the patient, and will take away precious time that is needed to actually make sure the patient is doing all right. Lastly is the integration of legacy system. Basically, this is talking about how the system is being integrated through through all the stuff. Furthermore, integrating the system will be quite challenging, as not all of the personnel that's in the hospital are very tech savvy. Furthermore, it's quite difficult to retrain staff to learn all of this new equipment. So in conclusion, there is many barriers to this, but at the same time, some steps can be taken to actually avoid all of this. Thank you.
So, to conclude the whole presentation, clinical information systems play a crucial role in modern healthcare, which transforms the way patient information is managed, shared, and utilized. Additionally, the system gives healthcare providers immediate access to the patient's medical information and history, providing them with important data when making clinical decisions at the bedside. This then allows for improved communication across all healthcare providers caring for a patient. So this concludes our presentation on clinical information system. Thank you.